Hello, I'm Sarah Helms, and I'm here to present to you my research topic and findings. My topic was on the eMERGE program, which is a program that's offered through the hospital that I work for in Coeur d'Alene, Idaho. And it offers treatment for pregnant mothers that are struggling with substance dependency and assist them in reducing or overall eliminating their substance use. This is a multifaceted program with a team that includes physicians, case managers, nutritionists, social workers, nurses, and developmental therapists. This program combines education, supportive services, and medically managed Subutex if that's indicated. Overall, I hypothesize that this program was successful in reducing substance use in the pregnant mothers. I found some great resources that offered some very useful information regarding the complications that are related to substance dependency in pregnant mothers and barriers that they may face in accessing the treatment that they need for their addictions. Substance dependency is a huge public health concern, and according to 4A 2016 in the United States in 2012, 5.9% of pregnant women used illicit drugs, 8.5% drank alcohol, and 15.9% smoked cigarettes, which resulted in over 380,000 offspring exposed to illicit substances, over 550,000 exposed to alcohol, and over 1 million exposed to tobacco while in utero. The effects that alcohol, drugs, and cigarettes can have on pregnant mother and her fetus can be great, and the risks range in severity depending upon the substance used and the length of use. Even though substance use is great and continues to increase in the United States, many pregnant mothers face both internal as well as external barriers to receiving treatment that they need for their addiction. One of the external barriers is that very few treatment facilities currently offer services geared towards pregnant women. And according to Crawford, Cius, and Goodwin 2015, in 2005, only 19% of treatment facilities within the United States actually offered services specifically geared towards pregnant women. There are many other external barriers as well. Some internal barriers include comorbid conditions such as psychiatric diagnoses, the fear of being reported to CPS, and the fear of being judged by service providers. Those individuals that are able to get into treatment appear to have greater success in remaining drug-free, and this is why I am interested in researching whether the eMERGE program is effective. There was research done by a program that's very similar to the eMERGE program that's based out of Canada, and their results indicated that those involved in an integrated care model had a decrease in substance use, had higher levels of compliance and care, and there was more positive outcomes medically for both the mother and her baby. The overall purpose of my research was to determine if the eMERGE program was successful in reducing or overall eliminating illicit drug use in the pregnant mothers. My study was a convenient sample composed of 9 individuals who entered into the eMERGE program. The consumers of the program can be referred by probation and parole, CPS, primary care physicians, OBGYN, or they can also refer themselves. To qualify, the individual must be pregnant or have delivered in the past 6 months, and the study was a quantitative exploratory record review. The NIDA modified assist scale was utilized to determine if there was an overall decrease in substance use in the mothers by the time they exited the program. My results were analyzed by conducting a paired samples t-test to determine if there was a reduction in substance use after they received treatment. There was a statistically significant decrease in substance use scores from pre-treatment with a mean of 44.44 and a standard deviation of 3.21 to the post-treatment with a mean of 34.67 and a standard deviation of 5.24. The mean decrease in substance use scores was 9.78. So overall, these results suggest that the eMERGE program is successful in allowing pregnant mothers that struggle with substance use to reduce their use of illicit drugs. Some of the limitations with this study included the lack of adequate time allowed to gather data. There was a limited sample size, and I also feel that this should have looked at mothers 1 to 2 years after exiting the program to see if they still remained substance-free and if they still had custody of their children. So in conclusion, substance dependency continues to be a nationwide public health concern. When this issue is done by pregnant mothers, this concern is heightened. Even though there were some weaknesses presented within this program evaluation, the results overwhelmingly did show evidence of success in reducing illicit substance use in pregnant mothers. In the future, it would be beneficial for this research to actually be conducted to determine if the program is successful in providing services for at-risk pregnant mothers and their unborn children. Some of the variables that I would recommend being extracted from the client records in the future would be age, relationship status, housing, did they identify supports, did they have previous substance use, and if so, what type was it? Was it inpatient, outpatient? How many months were they in the program, as well as there are many others that could be extracted. Inferential statistics could also be conducted to answer several questions, including does weekly program participation affect program completion? Does previous substance abuse treatment affect the outcome of program completion? I would also recommend that researchers collaborate with those from similar programs to ensure that the best services are being provided for the clients that are participating in the program. So overall, that concludes my research. Thank you for listening.